Let's go through some frequently asked questions about Ebola virus. Number 1. What is Ebola? Ebola is a rare and severe viral disease caused by the Ebola virus. It primarily affects humans and non-human primates such as monkeys, gorillas, and chimpanzees. Number 2. How Ebola virus look like? Ebola virus looks like a long, thread-like filament, often forming loops, twists, or U-shaped structures. It has a smooth, cylindrical appearance with an outer envelope. Under an electron microscope, it resembles a coiled rope or a worm, making it visually distinct among viruses. Number 3. How is Ebola transmitted? Ebola is transmitted through direct contact with blood, body fluids like saliva, sweat, urine, feces, vomit, breast milk, or semen, or tissues of an infected person or animal. Ebola can also be transmitted through contaminated objects such as needles or medical equipment. Infected animals, during hunting or consumption, are also the source of Ebola virus. It does not spread through the air, water, or casual contact. Number 4. What are the symptoms of Ebola? Symptoms typically appear 2 to 21 days after exposure and include fever, severe headache, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, and unexplained bleeding or bruising. Number 5. What are the complications of Ebola virus infection? Complications of Ebola virus infection can include severe dehydration, multi-organ failure, and shock due to significant fluid loss and bleeding. Other complications include liver and kidney damage, impaired immune response, and neurological issues like confusion or seizures. If untreated, Ebola can be fatal. Number 6. Is there a cure for Ebola? Currently, there is no specific cure for Ebola. However, supportive care such as rehydration, maintaining oxygen and blood pressure, and treating infections can improve survival. Antiviral treatments like Inmazeb, a combination of monoclonal antibodies, and Ebola have shown promise. Number 7. Are there vaccines for Ebola? Yes, the ERV-EBO vaccine, a single-dose vaccine manufactured by Merck, has been approved for use against the Zaire strain of the Ebola virus. It is highly effective and is often used in outbreak areas. Number 8. How is Ebola diagnosed? Ebola is diagnosed through laboratory tests, including polymerase chain reaction, PCR, testing, ELISA, and by virus isolation. Number 9. Who is at risk of getting Ebola? Those at risk of getting Ebola include healthcare workers and family members caring for infected individuals. People handling infected animals or consuming bush meat are also at high risk of getting Ebola virus infection. Number 10. How can Ebola be prevented? Avoid contact with blood and body fluids of infected individuals. Use protective equipment if you are a healthcare worker. Avoid consumption of bush meat. Practice good hygiene, such as frequent hand washing. Get vaccinated if you are in a high-risk area. Number 11. Where do Ebola outbreaks occur? Ebola outbreaks typically occur in sub-Saharan Africa. Countries like the Democratic Republic of Congo, Guinea, Sierra Leone, and Liberia have experienced major outbreaks of Ebola. Number 12. Can someone recover from Ebola? Yes, many people recover from Ebola, especially with early supportive care. Survivors often develop immunity to the strain that infected them but not to other strains. Number 13. Can Ebola survivors infect others? Survivors generally are not contagious after recovery. However, the virus can persist in certain body fluids, like semen, for months. Safe practices are advised for survivors to prevent potential transmission. Number 14. What is being done to control Ebola outbreaks? To control Ebola outbreaks, infected people are quickly isolated, and those who had contact with them are monitored. Vaccines are given in high-risk areas, and healthcare workers use protective gear. Communities are taught how to stay safe, and countries work together to stop the spread. Number 15. Can animals spread Ebola to humans? Yes, infected animals such as bats, monkeys, and apes can transmit the virus to humans. Handling or eating raw, undercooked bush meat from infected animals poses a risk. Number 16. Is it safe to travel to regions with Ebola outbreaks? Traveling to regions with outbreaks requires caution. Follow health authority guidelines, avoid affected areas, and practice good hygiene. If you are a healthcare worker, use proper protective equipment. Thank you for watching. If you found this video helpful and informative, don't forget to like, share it with others, and subscribe to our channel for more content on microbes and microbiology. Stay safe, Stay informed and we'll see you in the next video.